Now, before we start, there's going to be 2 minutes presentation from a Dr. Beyene. Dr. Beyene, this is a new breakthrough for Medkai. We have a paediatric neurology training bursary. Dr. Beyene's come from Ethiopia to Nottingham to learn about paediatric neurology, and in the process he's been educating people here about where he comes from. So I'd like to present him with our certificate, and it's Dr. Gabby Chow's been looking after him and clothing him when his suitcase didn't arrive and all sorts. Gone beyond the call of duty there. So I'd like to present you with this and let you give us a couple of minute rundown on what you've been up to.
Good evening, ladies and gentlemen. I have been already introduced by Dr. Caroline. Thanks so much for having me here. I am from Addis Ababa University, Ethiopia, and I am a pediatric neurology trainee. And for those of you who are not familiar with this country, Ethiopia, it's in the Horn of Africa. It's located in the Horn of Africa, the most eastern part of Africa. The capital city is called Addis Ababa, and it has 2.7 million inhabitants. And the total population of the country is 73.9 million. And if you see the gross national income, it is $330 per capita. And if you compare it with UK, it is 41,370. Those children less than 15 years of age account for 44%, and pediatric neurology service is at its infancy. And this is just to show you some of the spectra of the place where I come from. The first are few of the street boys and girls. We have around more than 100,000 in Addis, in the capital only. And the other area is one of the slum areas in Addis. And in the bottom you'll find me, my child, and my wife. Just to say, few points on infant mortality rate to compare it with UK. Ethiopia is 7.1 per 1,000 live births, and that of UK is 4.6 per 1,000 live births. You can imagine how high it is in my country. And the other is, if you see the population, Ethiopia's population is a bit bigger than United Kingdom's population, and if you see the child proportion, it is 44% in Ethiopia, as opposed to 19% in UK. And if you just compare the number of adult neurologists, it's only 16 in my country, as opposed to more than 500 here. And pediatric neurologists, it's only 3 versus 110. I will be the 4th. If you see some of the investigations available to practice pediatric neurology in Addis Ababa, where I come from, you can have serum, CK, muscle biopsy, ultrasound, X-ray, and CT scan in the best university in Ethiopia. Whereas you don't find MRI, evoked potentials, EEG, and nerve conduction studies, and EMG in the teaching hospital, but they are a bit available in the private sector, in the capital city alone. PET, SPECT, metabolic tests, and genetic tests are unthinkable at all. Let me say a few words about anticonvulsants. In my practice, I was practicing only 5 anticonvulsants: phenytoin, phenobarbital, clonazepam, carbamazepine, and sodium valproate. Whereas in UK, you have more than 20. I happen to see 23 anticonvulsants on the booklet on National Society for Epilepsy in UK. Medical training in my country, there are 21 universities. 8 universities give undergraduate training in medicine, and 2 private hospitals also do the same. Only 3 universities give postgraduate training in medicine. To see some points about neurology training in Ethiopia, the adult neurology is as you see it above, and on the bottom line you see pediatric neurology training, 6 years of general medicine training, then you serve in the population as a practitioner, and then you join university again to study pediatrics and child health for 3 years. You graduate and again serve as a pediatrician, and you join university again to study pediatric neurology, 1 year adult neurology. I have studied it in Addis, but the rest 1 year pediatric neurology is not available in my country. That's why I come here to fill that gap. Just to have some pictures. Above, that is the biggest hospital in the capital city. And underneath, you see patients, 2 patients in above 5 wards. Both were suffering from chronic rheumatic heart disease, which is quite common as a sequelae of rheumatic fever, which is quite common in developing countries. What do I learn after coming here? There are lots of things which I learned. This is only to mention few, especially pediatric neurology history and physical examination, and the neuroradiology meetings in adults and in pediatrics, and appreciating the role of genetic and neurometabolic testing, and especially EEG, that is quite important for developing nation like me, and a very strong computerized healthcare system. I have to appreciate that. And lots of things that I listed here. That's what I learned in my 3 months stay in QMC. And as it has already been said, as funded by Medkai Nottingham, and I would like to pass my heartfelt thanks to Medkai Nottingham. Thank you again. I also want to extend my acknowledgement. Dr. Gabriel Cho, she has really been a very great person for me in my life. In my stay here, she was like a sister and a mother. Dr. Adrian Wills, Dr. Abna Mangasha, Dr. Suresh Patal, special thanks to him as well, very much. Dr. Whitehouse, Dr. Magnan Tsagay, and Kutazanaba. These are very important people which play key role here. And finally, I would like to say thank you. Thank you.